Hello, hello. Good morning, good evening, good afternoon, because our webinar is streaming to the different part of the world. So, welcome everyone, I guess, and I hope that you hear me quite okay. So, please confirm on the chat below. Great, thank you very much. So, welcome on our webinar about how to take care of our best friends, I guess, horses in this case. And I'm really proud and happy to have as a host for today's webinars our friend from Australia, Camilla. Good morning, Camilla.
Good morning, Martin. How are you?
Fine, thank you very much, and I hope you're also fine. Camilla is a highly respected and sought after equine naturopath based in Australia and consulting globally. So that's very good for us because we have customers from different parts of world. So it's good to know. She's an experienced equestrian and has had an active lifelong involvement in the thoroughbred breeding and racing industry. She is also graduate of the Darley, now Godolphin Flying Start program, and graduate with a high distinction in her draft year. Camilla is passionate about solving challenging equine health conditions through holistically evaluating horses and employing targeted dietary, nutraceutical, Western herbal medicine, and management practices. As I mentioned, I'm really happy that Camila is today with us. So, Camila, welcome, and let's start our webinar.
Thanks, Martin. So today we're going to talk about ulcers and gastrointestinal health in horses. So rightly so, they're really pertinent topics in horse health. And I think to do the best by our horses, it's really good to have an understanding of just how extensive gastrointestinal health is, um, and how it systemically affects our horses, and things that we can do as horse owners and breeders and riders and trainers, things that we can do to promote really good gastrointestinal health in our horses, and things we need to be aware of that can have adverse effects or complications in terms of gastrointestinal health. So to get a really comprehensive understanding, it's most helpful to discuss briefly or discuss in some points in length about what gut health is in our horses. We'll look at some aspects of digestive function. Then we will delve into ulcers and different treatments of ulcers and what we need to be aware of if we choose to go down a treatment path. So firstly, what is gut health? I think it's a term that's thrown about quite a lot in the horse industry, and again, for really good reason. Um, but I think often when we hear the term gut health, we simply think of our horses' stomachs. Yet it's so much more than that. So, gut health involves the whole of a horse's digestive tract, everything from the mouth. So, oral health is really, really important, through to the esophagus, then through to the stomach, the small intestines, and the large intestines. When we talk about gut health, we need to consider the integrity of the cells that line the gut. We'll get into more detail in this in further slides. And the function of these cells and what it means for these cells to be selectively permeable. Throughout the whole digestive tract, there is a complex population of microflora. So as humans, we have a microflora balance throughout our digestive tract. Horses do too, although their microflora is quite different. But these microflora serve really specific functions to promote our horses' health and well-being. So we'll look at that further. A healthy digestive system, and particularly in the stomach, should produce a fine layer of mucus. This helps to protect the stomach lining, and it's one of the many inbuilt mechanisms a horse has to buffer against hydrochloric acid damaging the gut lining. So we want to be promoting this quality mucus production, and there are several things that interfere with that. particularly the use of some medications. Gut health involves the production of digestive enzymes and hydrochloric acid. So we will discuss at length hydrochloric acid, why this is normal in our horses and why it's so important. And digestive enzymes, in addition to hydrochloric acid, help break down the feed we give our horses into little molecules that they can absorb and utilize and metabolize and incorporate as cells in their body as well as energy sources. And having a correct pH throughout the whole digestive tract is really, really important. So there's pH in the stomach that influences the pH in the small intestine, which influences the pH in the large intestine. Now, different sections of the gastrointestinal tract have specific pHs that they need to stay within. And when we get aberrations or drops or increases in pH outside these narrow regions, that in turn really affects the population of the gut microflora, in addition to affecting the activity of those digestive enzymes. So again, particularly in recent years, there's been a lot of focus on gut health, and it's, in all fairness, it's really well deserved. Gut health affects so much more than just the gastrointestinal tract or the digestive system itself. So we know that gut health is absolutely essential for the proper digestion and absorption of nutrients so that our horses can actually utilize the feed we're giving them, that they can extract the energy from that, as well as the nutrients that they need for normal metabolism and normal cellular turnover and integrity. So recovering from the training or racing or competition or riding we're doing with them. Gut health is really important for synthesis of particular nutrients. So unlike humans who we consume B group vitamins in food and things like that, horses synthesize their own B group vitamins through healthy gut microflora, particularly the hindgut. So if our horse's hindgut doesn't have a healthy microflora population, their ability to synthesize B group vitamins is quite impaired. B group vitamins serve many, many functions in the body, particularly in relation to energy metabolism, in relation to mood, so neurotransmitter production and function. They're needed for hoof health, so biotin is a B group vitamin. And on that, it is really common for horses who have really poor hoof health to also have really poor gastrointestinal health or gut health. And that's one of the many reasons why. Those hindgut microflora also synthesize vitamin K, which is needed for normal bone health or good bone health and normal blood clotting. The state of the cells lining the gut, and again, the microflora population of the gut, influence about 70 to 80% of immune function. So again, if we're having immune challenges in our horse, whether it's chronic infections, respiratory tract infections, ongoing hoof abscesses, whether they're the kind of horse that they get a tiny cut or a tiny nick on them and their whole leg blows up, coming back to gut health is really important. Similarly, inflammation levels are dictated largely by the state of the cells lining the gut and the gut microflora. So again, we're looking anywhere from 60 to 80% of inflammation produced within the body is mediated by the gut. And again, I think that's really important when we have inflammatory conditions in our horses. It could be equine asthma, it could be skin conditions, it could even be an injury in a horse, an acute injury, so suspensory injury or a bowed tendon or something like that. If gut health is really good, the inflammation in relation to that injury or illness will be far less, which is highly desirable. So the gut and the brain have a really strong connection. We call it the gut-brain axis. And we know that the microflora in the gut, and again, some of those particular cells lining the gut, are responsible for about 70 to 80% of neurotransmitter production and function. And in particular, things like serotonin, it might even be as high as 95%. We will discuss these further down the track, but this is a really important consideration, particularly in horses that are flighty, that are temperamental, that are cranky, that seem to spook at everything. Again, gut health has a huge role in this. We know that the microflora have a significant influence on metabolic rate. And again, this is an important consideration, particularly in horses who are insulin resistant, or our overweight horses, or our horses with equine metabolic syndrome. In the past, it was often thought that these horses were best kept on starvation diets or with minimal feed. As we will discuss further in the presentation, the effects of this on gut microflora and on cortisol levels, it was actually one of the worst things we could do for our horses. So having a really healthy gut microflora is really important to help our horses have optimal metabolic rate. Just going back to the gut-brain axis, like the brain, the gut has its own independent nervous system. So it's the only other organ in the body which can run itself without input from the brain. We know that gut health is intimately linked to skin and coat health, and we also know that it plays quite an important role in thyroid function. So as we can see, gut health is not just about digestion and absorption. That's certainly really important, but it affects the whole body systemically. So what makes healthy gut function or digestive function in our horses? We're going to cover all these points in detail in further slides, but just a brief overview. So our oral or dental health in our horses is really important, and the action of chewing. High fibre diet, or a diet predominantly based on fibre, is super important to promote that healthy gut microflora. Our horses have evolved to be what we call trickle feeders. So in the wild, horses will be grazing for 16 to 18 hours a day. Their stomach, in particular, is designed to be getting small amounts of feed often. This is part of preventing gut overfill or stomach overfill, and of always having feed present in the stomach, particularly fibre in the stomach, which is one of our horses' many natural mechanisms to protect against gut ulcers or gastric ulcers particularly. Our horses, again, digestive systems within reason are designed to have minimal starch, or having a diet that has minimal starch in most cases. There are certainly exceptions to the rule. In high performance horses with really high energy needs, provided there's still enough fibre in their diet, then starch, has an appropriate place. But for most horses, we want to be looking at a minimal starch diet, particularly horses with compromised gut health. A good microflora balance is really essential for healthy digestive function in horses, and hydrochloric acid, which has a key role in digestion, but so much more, as we'll discuss further. So oral health and dental health has a significant impact on our horses' gut health and our horses' digestive health. So digestion begins in the mouth. So chewing has many functions in a horse, obviously to break up the feed they're consuming. But whenever a horse chews, they produce saliva. So humans can produce saliva when we think about food, when we smell food, when we see food. Horses only produce saliva when they're chewing. And this is one of their key mechanisms to help set the right pH throughout the gastrointestinal tract, and to help provide a buffer to the lining of their stomach to help protect against ulcers. So one of the constituents, or one of the parts of saliva, it has bicarbonate buffers in it. So the more a horse chews, the more saliva they produce and the more bicarbonate buffer they produce, which is really what we want. Their saliva also contains what's called salivary amylase, which starts the digestion of carbohydrates in the diet. Horses have a really unique chewing action. So if you watch a horse graze, watch a horse consume hay or pasture, you'll notice that their action of their jaw makes what we call a sweeping motion. So they don't just go up and down, they go laterally, they go sideways, they go backwards. And there is a little bit of up and down, but it's not just up and down. This We call this action a sweeping rate, and a horse's upper jaw is wider than their lower jaw to make this sweeping action possible. We know that horses that are grazing chew a lot more than horses that are confined to a stable or a yard with limited feed. So on average, a horse that is out grazing in a paddock will make 60,000 jaw sweeps a day. We know that when our average size horse, so a 500 kilogram or 1,100 pound horse, takes about 40 minutes and 3,400 jaw sweeps to consume 1 kilogram of hay. Ponies will generally take twice as long. Now compare this to when they eat 1 kilogram of oats. They consume that in only 10 minutes and only 850 jaw sweeps. So that's a lot less chewing, that's a lot less saliva production. So we've just reduced one of our horse's key mechanisms to help promote a really healthy gastrointestinal environment. The action horses take, so their jaw sweep action, when they consume fibrous feeds, so particularly what we call long stem fibres. So that's fibre in the form of hay and grass, particularly mature grass. They use a really long jaw sweep action. This helps promote even wear on their teeth. And we find that horses that are continually out on pasture with minimal grain or concentrate feed in their diet rarely have sharp edges on their teeth. And again, this is really important considering we want our horses to chew more, and the more comfortable they are, the more likely they are to chew more when they're eating. So a high fibre diet is really important through many mechanisms. So it helps to stabilise blood glucose levels. So when there's higher fibre in our horses' diets, it is one mechanism which helps to prevent what we call peaks in blood glucose levels, which have associated peaks in blood insulin levels. Now, this is particularly important in our overweight horses and in our horses and ponies who have insulin resistance and or have equine metabolic syndrome. Fibre itself provides a physical buffer in the stomach. So we know that one of the main contributing factor to ulcers, particularly gastric ulcers, is the splash of acid against the lining of the stomach. So hydrochloric acid, which our horses need for normal health, when that splashes against the gut lining and there's no protective factor, that can cause erosion and damage to our gut lining. Now, when our horses are on high fibre diets, that fibre helps to provide a buffer against the acid splashing against the gut lining or the stomach lining. So it's a real protective mechanism. And thinking back to the fact that horses are trickle feeders and that in the wild they're consuming grass and forage for 16 to 18 hours a day, they've always got that protective fibre layer in their stomach to protect against that, the hydrochloric acid hitting their gut lining. Fibre helps to slow digestion. Now, in our horses, within reason, we want to slow the passage of food down. And again, within reason, there are exceptions, but within reason, the slower feed goes through our horses, the better, in that it gives the cells a better chance to absorb and utilise the nutrients passing through. Fibre is one of the key things we need to promote that healthy microflora in our horses' digestive tract. So fibre for them is a feed source. And when we discuss microflora in one of the coming slides, we will see that they are very specific. The populations and types of microflora are really specific to the feed we give them. And the best microflora are promoted through high fibre diets. As we discussed with chewing, fibrous feeds promote more chewing, and this results in the more production of saliva and therefore more bicarbonate release. High fibre, as we discussed before, promotes healthy teeth wear, which is really important. A factor about saliva, which I didn't mention before, is it helps to neutralise acids and the pH in the mouth, which helps to protect horses' teeth, so it promotes oral health. and also helps to prevent against gingivitis and periodontal disease. We know that when horses are eating slower, it's harder for them to overfill their stomach. So a horse's stomach is really small in comparison to the actual size of a horse. So again, your standard 500 kilogram, 1100 pound horse has a stomach which only has a capacity of 9 to 15 litres. So again, in comparison to the size of a horse, that's really small. And the stomach has a really limited ability to expand. So we certainly don't want to be overfilling our horses' stomachs. So touching on minimal starch, some of the reasons we don't want a high starch diet, as a general rule, is starch raises blood glucose and blood insulin levels. And again, in terms of promoting optimal health, we want these, both blood glucose and blood insulin, to be fairly stable. We also know that when we get peaks in blood glucose and blood insulin, that can be a real driver of excessive inflammation. And again, there's a certain amount of inflammation, natural inflammation, that our horses need, and that's important, but we certainly don't want excessive inflammation. Starch generally requires less chewing. So then if a diet is predominantly starch, we negate a lot of those benefits we get from saliva and bicarb production. Starch generally passes through the digestive tract really, really quickly. So again, we minimize the benefit of slow digestive function. The types of microflora starch promote are generally not healthy. This one's quite complex in that there are other factors that influence this. So if we've got our horses on a high starch diet, combined with the use of ulcer medications such as omeprazole, this can be a real issue in that fibre will ferment in the gut. And when we discuss ulcer treatments, we'll talk more on this. If we give our horses large meals containing large amounts of starch, they will pass through the stomach really quickly, through the small intestines really quickly, and a lot of that starch can end up in the hindgut undigested. Now, this is a real problem because the only thing that should end up undigested in the hindgut is fibre. When we discuss the microflora, we'll see why. But basically, in short, a lot of starch or starch reaching the hindgut undigested shifts that microflora population to a really unhealthy one and can result in the production of lactic acid and will kill off healthy hindgut microflora. So we really don't want that. And the bigger the meal and the more starch it contains, the more likely it is to do that. The type of starch is relevant too. So some forms of starch have better digestibility than others, and some feeds have better digestibility than others. In terms of feeds that are really problematic, one of the worst things in terms of starch digestibility is cracked corn. We know that cooked feeds, in terms of digesting that starch, are better than cracked or uncooked or raw or rolled feeds. So that's definitely an important consideration. When we talk about starch too, it's important to consider what else is fed in that same feed. So if you've got a horse that you feel or is recommended that there's starch in the diet to meet its energy needs, then you want that combined with a significant source of fibre to help slow that digestion and to help mitigate some of those effects of a high starch diet or starch in the diet. Most of our starch containing feeds are grains or feeds that need very little chewing. And again, this can result in uneven wear on a horse's teeth, which we don't want. So looking at the gastrointestinal microflora, keeping in mind that we're really, in terms of research, we're really in the infancy of knowing specifics about different populations. So when we talk about the microflora, it encompasses bacteria, fungi, protozoa, archaea, and even viruses. So there are some viral populations kept in certain amounts that are actually really important throughout our horse's digestive tract. We also know that the population of microflora is really dependent on what our horses are fed, so we can shift and change that. But we also know that there's a big genetic component and a big individual component. So we can have two really healthy horses and they can have quite different microflora populations or specifics of them. We could almost do a whole webinar on microflora, so we will take it from a more broad perspective. So we know that, as we touched on before, in the hindgut, microflora synthesize vitamins, so particularly our B group vitamins, biotin, and vitamin K. Those healthy hindgut microflora ferment fibre. So part of their role is to ferment that fibre, which provides a really good energy source for our horses. And I'm not a fan of the term cool energy or heating energy, but it provides energy that helps keep stabilized blood glucose levels and has no impetus to changes in our horses. So we want our horses to be fermenting fibre as an energy source. And it does this by these microflora break that fibre down into what we call short chain fatty acids or volatile fatty acids, which are absorbed into the bloodstream. The production of them too also release protective factors, which help to further reinstate that really healthy gut microflora and directly protect the gut lining. So if we're now looking at the hindgut, this can help protect against colonic ulcers. So we want the production of short-chain fatty acids and volatile fatty acids in the large intestine. Those microflora, when they ferment that fibre, also produce substrates which help to reduce and modulate inflammation. So again, looking at that systemic inflammatory picture, that's a really important factor. As we touched on earlier, they have a huge role in immune function and the production of white blood cells. They influence metabolic rate. They influence the production of neurotransmitters, particularly serotonin. So serotonin is responsible for our horses for feeling calm, for feeling happy. It's a mood stabilizer, as well as dopamine. So dopamine has some similarities to serotonin, but also is a rewarding neurotransmitter. So it gives our horses a sense of reward. It's involved in learning, and it has a really important function in promoting normal blood flow to the gastric mucosa. So again, when we touch on ulcers, this is a really important consideration to keep in mind. So we want a healthy microflora population in our horses, and we want to be feeding them a high fibre diet, as that is one of the most simple and most crucial mechanisms to help promote this healthy gut microflora. So now we're going to look at hydrochloric acid. So horses produce hydrochloric acid all the time. It's produced by cells in the stomach called parietal cells. And it is, I can't emphasize this enough, it is really important and normal for our horses to produce hydrochloric acid. It's not something we want to be shutting down. Hydrochloric acid is absolutely essential for protein digestion. So it initiates protein digestion in the stomach. It's responsible for setting a specific pH in the stomach, which then influences pH throughout the whole gastrointestinal tract. And those digestive enzymes needed, particularly in the small intestine, are really sensitive to changes in pH. So if we increase the pH in the gut through shutting down hydrochloric acid, we affect the activity of those enzymes further down the digestive tract. And basically, it means our horses can't digest and absorb and utilize that feed properly. The microflora in the digestive tract, again, are really sensitive to narrow ranges in pH. So we don't want to be messing around with that pH because it will result in changes in population and what we call dysbiosis, which is overgrowth of unhealthy microflora and microbes. Hydrochloric acid is essential to stop fermentation of carbohydrates in the gut, in the stomach in particular, So when horses consume carbohydrates, so our grain feeds, our processed feeds, our concentrated feeds, digestion of them is initiated, so it's already started in the mouth. remembering that saliva produces both the bicarbonate buffer, but also amylase, which initiates carbohydrate digestion. Now, when our horses have meals that only have small amounts of starch and they've got that hydrochloric acid production going, that's not a problem because fermentation of them stops. The acidic nature of hydrochloric acid stops that. If that mechanism is missing, however, then that starch can ferment in the gut and that can cause a lot of problems. Hydrochloric acid is a first-line immune defense. So for ingested pathogens and parasites, it can be something that knocks them on the head or certainly inhibits their activity. So it's an important component of the immune system. A really important thing to note is that hydrochloric acid is needed to what we call dissociate our minerals. So all the minerals we feed our horses, things like magnesium, iron, zinc, phosphorus, calcium, they all travel around with a little buddy. So they're all linked up. They don't just travel around as single molecules. They're compounds. We need that hydrochloric acid to split those compounds to make those minerals available for digestion and absorption. And when our horses aren't producing hydrochloric acid, they lack what is needed to dissociate those minerals, to make them available for digestion and absorption. So knowing all these things, it can also be really handy to know what some of the biggest insults to digestive health in our horses are. Firstly, poor dental health. So if our horses can't chew properly, then we have reduction in saliva production. We also know that gingivitis and periodontal disease can have systemic inflammatory effects. So although the condition might be in the mouth, the effects of that inflammation and the bacteria associated with it that they harbour can cause real problems, even in things which may seem really remote, but in things such as fertility. So we want good dental health in our horses. And part of that is feeding them that high fibre diet and encouraging chewing. Large, high concentrated or high grain meals through their changes in what they can do to gut microflora, in that if they're large, they can ferment in the stomach, in that they have fast passage through the digestive tract, they are not good for our horses. Infrequent feeding and or withholding feed. So again, thinking back to how fibre protects the gut lining from the action of hydrochloric acid against the gut lining or the stomach lining, it's really important that we allow our horses, or that our horses are constantly grazing. So there's good research to show that in as little as 4 hours without feed, horses can develop gastric ulcers. So if we think of horses, that are in stables or in yards overnight and have finished their hay long before we're up in the morning, then that's a really important consideration. There's even schools of thought that that time frame may even be smaller than 4 hours. Even potentially as small as 2 hours in susceptible horses. So we want our horses to be chewing and eating all the time. Lack of fibre. So again, particularly long stem fibre is a real insult to our horses' digestive health. Antibiotics, non-steroidal anti-inflammatories, corticosteroids, and I've put an asterisk next to ulcer medications. So the way these affect our horses' digestive health are quite varied. In terms of antibiotics, we use them to treat bacterial infection, but they wipe out the healthy gut microflora in our horses too. Non-steroidal anti-inflammatories, so this includes things like phenylbutazone, also known as Bute or PBZ, if you're in the US, Flunix, so Banamine, meloxicam. They change blood flow to the gut. They also inhibit the production of specific prostaglandins. So again, just referring back to some inflammation is essential for our horses. 1 or 2 particular inflammatory pathways are responsible for the production of mucus. So that's that nice protective coating throughout the gastrointestinal tract and in the stomach. The use of non-steroidal anti-inflammatories and corticosteroids stops or severely limits the production of mucus, so that one of those protective mechanisms throughout a horse's digestive tracts is wiped out. Non-steroidals and corticosteroids also have an impact on that healthy gastrointestinal microflora too. So it's a bit of a double whammy. But yeah, two of the main focuses are reduction in mucin production and changes of blood flow to the stomach. Now, ulcer medications, particularly long-term, are an insult to digestive health in that they shut down the production of hydrochloric acid, which is needed for all the reasons we discussed before, because this will have a flow-on effect in changes in particularly microflora population, but also digestive enzyme function. And yeah, shutting down hydrochloric acid production has that massive flow-on effect. Stress is a huge insult to digestive health, and I think we need to think outside the box in terms of stress. So stress isn't just that horse that's pacing the paddock that gets its knickers in a knot when we take its mate away. Stress, what our horses physiologically perceive as stress, is really wide and varied. So social changes in our horses can be a form of stress. Particular nutritional deficiencies or insufficiencies are a source of stress. Weaning is definitely a source of stress. Travel. So again, their sources of stress are wide and varied, and we can have horses that on the outside are quite calm and internally seem calm, but what their body perceives as stress and what initiates changes in cortisol levels can be really wide and varied. Particular nutritional insufficiencies and deficiencies can compromise gut health, particularly protein and specific amino acids that are needed to help promote a healthy gut lining. And there are particularly minerals too that are incorporated into gut lining. And if they're in short in a horse's diet, that can be a significant insult to digestive health. Sudden changes in feed are also a huge consideration. So when our horses consume different feeds, their microflora population changes in line with the feed that they're consuming. I always make recommendations that when we're changing a horse's feed, we do it over a 12 to 14 day period to allow gradual changes and adaptations in gut microflora. If we change feed suddenly, we can have a big die-off in the microflora that are currently inhabiting the horse's digestive tract, and that can be implicated in things such as colic. So that's one of the many reasons we want to make feed changes relatively slow. So what happens when gut health goes wrong? So as we talked about before, our horses' intestines, or the lining of them, are selectively permeable. So what that means is it prevents against the loss of water and electrolytes, but it allows the entry of antigens and microorganisms into the body, but it allows the exchange of molecules between a horse and the environment and the absorption of nutrients in the diet. So in our horses, the cells lining the intestines should be nicely interlocked like that and make a nice tight knit. When their intestinal health is compromised, though, the gaps between the cells can become quite big. It results in compromised lining of the intestines, and we call this intestinal hyperpermeability. So gaps between those cells in the intestinal wall allow bacteria and undigested feed and other metabolites that shouldn't go directly into the bloodstream. It allows them to pass directly into the bloodstream. This can lead to excessive levels of inflammation, abnormal immune responses, and it changes the gut microflora population to an unhealthy state, which we term dysbiosis. So it's really important, again, coming back to how the gastrointestinal tract has such wide-bearing implications on the whole digestive system. A lot of health issues can arise from intestinal hyperpermeability and or changes in gut microflora. Those two things generally, not always, but generally go hand in hand, and their implications can be really widespreading. So we know that they can be associated with ulcers, with laminitis, with respiratory tract infections and equine asthma, allergies, high levels of inflammation, stressed or anxious behavior, chronic and or recurrent infections, equine metabolic syndrome, failure to thrive or put on weight or weight loss, inflammatory bowel disease, and tying up. Just an interesting one on failure to thrive or put on weight loss or weight and how it relates to intestinal hyperpermeability and changes in gut microflora, which I think is really important to note, is I see commonly in clinical practice horses that are getting fed a lot of feed yet are failing to put on weight or dropping weight. And I think it's a really natural instinct. If we've got our horse who, is looking poorly or not doing well, we think we need to feed them more and more and more. This can just further compound the issue in that it will further promote unhealthy gut microflora and can certainly promote more compromised intestinal health. A lot of these horses, it's not lack of feed is not the reason they're not putting on weight. As you well know, because the more you feed them, they're not getting any more condition on them. Until we address the state of their intestinal health, feeding them more is certainly not the answer. And most of these horses, I significantly reduce the size of their concentrated meals, but up the fibre in their diet in conjunction with both herbally and using nutraceuticals to reinstate really good gut health. And a lot of these horses go on to do really well on a lot less feed than they were originally getting, that they were losing weight on. So if you've got a horse that's dropping condition or not holding condition and you're feeding it really large amounts of feed and you're finding that the more you feed it, it's still not putting on weight, you're probably actually shooting yourself in the foot in that it's perpetuating the problem. So it's not that you're not feeding your horse enough energy or enough feed, it's that the horse can't digest and utilize that. And adding more feed to that will further make that more difficult. So now to the juicy part. What is equine gastric ulcer syndrome? Sorry, tongue-tied there, or ulcers. So essentially they're sores or erosion to the stomach lining. We know that 60 to 90% of horses are affected by gastric ulcers, and it's certainly not limited to performance horses alone. We know that foals can experience them. We know that pleasure horses can experience them. And they're graded on a scale of 1 to 4, depending on their severity, with 1 being mild and 4 being very severe. So ulcers are largely a man-made disease. From my perspective, I think it's really important that we look at ulcers as a sign or a symptom and not the main issue. Now, certainly we definitely don't want our horses to have ulcers and we definitely want them to heal. But ulcers don't happen out of the blue. Being a man-made disease, it's our management, our feeding, medication use, and lifestyle factors that allow ulcers to occur in our horses. And if we get really hung up on just treating the ulcers, but not addressing or changing those factors that led to the ulcers, then we've missed a really good opportunity to promote health in our horses. So certainly, if I'm treating a horse and it has ulcers, that is a concern. And by effect, the changes we will implement will help to address that. But I'm not focusing solely on ulcers. I'm looking at what is happening for that horse to have developed ulcers in the first place. With that too, I think, again, taking the focus away from ulcers, the absence of ulcers doesn't necessarily equate to a really healthy gastrointestinal tract. So we can have dysbiosis in our horses without ulcers. We can be doing gastroscope in our horses to look for ulcers, and they might not be there, but that's not necessarily a green tick. It doesn't necessarily mean we're doing all we can to promote really good gastrointestinal health in our horses. So again, just to recap, ulcers are a man-made disease. We know that they are largely related to our feeding practices, the way we manage our horses, the environment, and the way we use medications in our horses. So how and why do ulcers occur? So in terms of gastric ulcers, we know essentially in most cases it is hydrochloric acid coming in direct contact with the gut lining. And this can be for several reasons. So it can be a lack of protective mechanisms. So going back to that all important fiber, both the physical presence of fiber in the stomach and bicarb production. It can be because of changes in healthy gut microflora. So they serve many factors to help protect the gut lining, and reduction or lack of mucus production. Again, this is generally associated with the use of non-steroidal anti-inflammatories or corticosteroids. And I've put plus or minus the pressure of exercise. So we know that horses who are undergoing strenuous exercise can have a push-up of gastric contents or splash of gastric acid, particularly into the upper portion of the stomach. Now, I put plus and minus because if we feed our horses sufficient fibre, the likelihood of this can be significantly reduced. There was a nice little study, it was done quite some time ago now, to show that feeding our horses was either 500 grams of lucerne or alfalfa, chaff or hay, sort of 30 to 60 minutes prior to exercise helped to provide basically both a physical buffer and to soak up some of that hydrochloric acid to stop the acid splash up. We know that ulcers occur due to the destruction or breakdown of protective factors in the gut lining. So again, things that do this are non-steroidals as well as stress. Changes in blood flow to the gut lining. So we know this occurs in relation to high intensity exercise, particularly the more time goes on. So if you think of some of those endurance rides where pace is really, really pushed, non-steroidal anti-inflammatories change blood flow, as do corticosteroids. And the other thing I haven't put there is that if our horses aren't producing sufficient dopamine, so one of those key neurotransmitters, that results in changes to blood flow to the gastric mucosa. So at a cellular level, what is happening when ulcers occur are compromises to those cells that line the gastrointestinal tract. We get inflammation, we get lack of mucous membrane defenses, we get changes in the quality of gastrointestinal mucus, and we get changes in bacterial or the microflora, so dysbiosis. So there's a couple of different ways we can classify ulcers. There are gastric ulcers, so these are ones that occur in the stomach, and here we've got a picture of our stomach. So they can occur in the glandular area of the stomach, which is this area. So these are where the glands that produce mucus and hydrochloric acid are, or they can occur in the non-glandular area. It's what we call the squamous area. Now, it's more common in foals and younger horses to get ulcers in the glandular area, but it is more common in performance horses and other horses to get them in the squamous area because it lacks some of those protective mechanisms. When I say it's more common for foals, in the glandular area, it's more common that a horse that's going to have them in this area of foals, and it's generally, we think, related to the use of non-steroidal anti-inflammatories or changes in blood flow. We can also get colonic ulcers. So these are ulcers in the large intestine or the colon of our horses. I think it's fair to say they've probably always been there, or, incidences of colonic ulcers have probably been around as long as incidents of gastric ulcers, but we've been less inclined to consider them or look for them. And certainly where we can do gastroscope to diagnose gastric ulcers in horses, we can't use that for colonic ulcers. So the best diagnostic method in terms of veterinary diagnostics for colonic ulcers is doing a trans-abdominal ultrasound. So again, if we're thinking about ulcers, the signs and symptoms can be really wide and varied. And I think it's really important to note that none of these are specific. So they can be quite vague and quite general and can relate to a lot of things, but they need to be considered in a holistic context. So again, when I'm consulting on a horse, looking at how it's been fed, how it's been managed, what medications it is on or has been on, what supplements it is and has been on, what's been happening for that horse in its life. So we view these signs and symptoms as part of a whole context, a holistic context. Before I go through these two, I think it's also really important to note that we can have horses that have ulcers and even quite severe ulcers with no outward signs. Whether the horse is just really stoic or it's just managing to do okay, we don't always see outward signs. The other thing I think is really important to note too is a lot of us come across horses at their different life stage. So there'll be some people who breed their own horses and have them right through and can tell you everything that's happened to that horse from go to woe. But a lot of us, if we're purchasing horses down the line, we might get a horse that's always cranky or always irritable or always girthy, and we might just think that that's the way the horse is. That's normal for that horse, where it may very well not be. It's just we've never had a chance to know a horse when it's been in really good health or has had really good gastrointestinal health. So they're important things to keep in mind. So some of the signs and symptoms of ulcers are failure to thrive, girthiness, so that horsey saddle that's always uncomfortable when you're doing up the girth, poor performance, unsettled in work or unwilling to work. Can be that horse that's always cranky, that's always temperamental, always got its ears back, that sour disposition. Poor manure, so smelly cowpat manure that's got undigested feed in it sometimes. That's always a sign that gastrointestinal health is not good. Poor coat health, so stark coat. If we're looking at blood tests, if they've been done for any reason, particularly in the case of ulcers, we will often find low white blood cell counts and often low albumin and or protein. And that is because our horse's gastrointestinal tract hasn't been able to properly digest and absorb those nutrients. A horse can still be eating but can be losing condition or weight. Really smart horses who have ulcers will often not eat, or who are in significant pain will be really slow to eat hard feed or not eat hard feed and will go for hay in preference, or grass or alfalfa or lucerne. So that can be a really telltale sign of a really unhappy gastrointestinal tract. Poor appetite, grinding teeth, crib biting, wind sucking, weaving, box walking, and stable vices. Now, these can be a bit of a chicken and an egg. So we know, particularly in relation to crib biting and wind sucking, that they are associated with ulcers. Now, whether they cause ulcers or whether ulcers drives them to do those behaviours is a chicken and egg. Colic, particularly our recurrent cases of colic, are often associated with ulcers, and poor hoof health. With a lot of these too, it's important to remember that these symptoms won't necessarily come on overnight. A lot of them can sort of gradually come on and on as the severity of their condition gets worse. So bear that in mind. So contributing factors to ulcers, many of these things we've touched on before, are insufficient fibre or chewing in the diet, large, hard, concentrated feeds, sudden shifts in gastrointestinal microflora. And again, this can happen through a variety of mechanisms. One of them can be sudden changes in feed. Stress in its many, many forms, withholding feed, high intensity and or endurance exercise, exercising on an empty stomach, weaning. So we know that weaning, particularly stable weaning and quick weaning, where we put our mares and foals in stables and suddenly take the mare away, that has a really high association with gastric ulcers. Probably likely through a variety of mechanisms. So the stress in itself, also the lack of nursing from their mother, so that milk provides gut feel and a protective factor. And often when we wean our foals, we take them from pasture, so they're grazing that as well, and suddenly put them on high concentrate diets. All those factors are really likely to why we see such a high incidence of ulcers in weanlings. When sucking or cribbing, so chicken and an egg situation, common medications, our non-steroidals, antibiotics, corticosteroids, proton pump inhibitors, how they affect. Another one to include there, and largely through its ability to shift gastrointestinal microflora, and that is anaesthetics. So if we've had a horse that's had surgery, that's had to go under general anaesthetic, it has significant changes in gut microflora. Nutritional insufficiencies and deficiencies, stabling, so generally that's because of lack of fibre and lack of ability to graze. Anything that suddenly shifts the gastrointestinal microflora or promotes dysbiosis, travel, and we know in terms of colonic ulcers that dehydration is commonly implicated. So our conventional veterinary approach in terms of ulcers is using gastroscope to diagnose. Now I've put a plus minus here. Many vets will do a gastroscope, but many will also go, look, I think it's ulcers. Signs and symptoms point to ulcers. So let's put it on omeprazole, which is typically the medication of choice. So I put gold star because it's considered in veterinary medicine the best treatment for ulcers. It belongs to a class of medications which we call proton pump inhibitors, and they work by stopping the production of hydrochloric acid by the parietal cells in the stomach. Now, omeprazole can come in both oral paste form and injectable form. Ranitidine is a less commonly used ulcer medication. It belongs to a class of drugs called histamine receptor antagonists, which work in a slightly different mechanism in that they stop the production of histamine, which then stops the production of hydrochloric acid. They are used less commonly, but they are certainly used in some cases. Sucralfate is become more commonly used in recent years in conjunction, typically with your omeprazole or your ranitidine, and it's also most commonly implicated in in colonic ulcers. So in terms of colonic ulcers, there is no indication to be using your proton pump inhibitors or your H2 receptor antagonists. So no indication to use omeprazole or ranitidine. As we discussed before, colonic ulcers can be diagnosed through using a transabdominal ultrasound. Again, this is a plus minus. Some vets will choose to do it, some will just choose to treat in thinking that colonic ulcers are a possibility. So in terms if we choose to use a gastroscope to diagnose ulcers, there are certainly limitations or downfalls to this. So we know that to definitively diagnose ulcers in a horse, gastroscope is needed to assess the severity and to definitely confirm that gastric ulcers are there. Keep in mind that it won't help us with colonic ulcers. The limitations and downfalls to this, however, is that feed needs to be withheld for 8 to 16 hours, and typically most vets will go for about 12 hours before scoping. Now, we know that there's good research to show that horses not having feed for as little as 4 hours, and feed includes fibre and pasture, is a significant risk factor for developing ulcers. So we need to seriously think about that one. As I mentioned before, the absence of ulcers doesn't automatically imply good gut health, so it can give us false reassurance and can allow us to become complacent on dietary management factors that we need to implement to promote healthy gastrointestinal health in our horses. And gastroscope doesn't extend beyond the stomach, so we know that horses can have colonic ulcers. So risks and limitations associated with omeprazole and ranitidine use really need to be taken into consideration. And I think more than anything, horses that we feel need to be maintained permanently on omeprazole and ranitidine or long term, we really need to stop and consider what these drugs do and how they work. So again, their mechanism of action essentially is to shut down hydrochloric acid production. And going back to the start of the presentation, hydrochloric acid has so many important functions throughout our horse's digestive tract, but in their overall health. So to shut that down, and particularly to shut it down long term, comes with pretty significant implications. So we shut down hydrochloric acid, we inhibit pepsin. We shut down hydrochloric acid and pepsin production. So our horse can't initiate normal protein digestion in the stomach. Now, thinking back, particularly if we're feeding our horse starch or carbohydrates in their diet, they have initial enzymatic action through amylase in the mouth. So they've started to be digested. If they hit a stomach that is not producing hydrochloric acid, the fermentation of that carbohydrate continues. And by fermenting in the gut, they're producing lactic acid, and they're also producing gas. So that creates incredible pressure in our horses' small stomachs, which have really limited ability to expand. We're further shifting the pH already. So if we've shut down hydrochloric acid, we've shifted the pH, the normal pH, healthy pH in our horses' stomachs, but we've further shifted that if we've got a whole heap of carbohydrates fermenting in the gut. I see a lot of horses in clinical practice that have recurrent colic and who are maintained on ulcer medications. Often these horses also have quite high grain diets. And from my perspective, it's not hard to see why, in that they've got a whole heap of feed fermenting in their stomach that can't be digested, that's creating shifts in gastrointestinal microflora population, as well as creating all this pressure in the stomach. We know that hydrochloric acid is essential for allowing minerals to be properly digested and absorbed. And the flow and effects too of changing microflora population through changing pH, through using our proton pump inhibitors or H2 receptor antagonists, that affects vitamin and mineral metabolism and absorption. We know that changes in that pH shift gut microflora or gastrointestinal microflora to a state generally of dysbiosis, so not a healthy balance. Compromised immune function, both directly, so we've lost one of our horses' first-line mechanisms to protect against microbe or parasitic or viral invasion, but we've also got the huge consideration of how healthy microflora influence immune function. If a horse isn't able to properly digest, absorb, and utilize feed, it's going to have a compromised ability to recover from training and injuries and illness. All those conditions need nutrition to help the horse be healthy and recover. We know there's been a good little bit of research to show that combining our ulcer medications with our non-steroidal anti-inflammatories actually results more commonly in complications with the combined use. So we see more incidences of colitis, of colic, of inflammation within the gastrointestinal tract with their combined use. We'll also get further changes in gut microflora population. And I think from a practical consideration, this is really important because it is really common practice, particularly in foals or horses that have injured themselves and might need to be on box rest and might need to go on to non-steroidal anti-inflammatories, to put them on omeprazole or an ulcer medication to help protect the gut. The complications of doing that extend beyond the gut, and I think extend beyond the stomach, and I think we need to be aware of that. And it should not, combining the two should not provide false reassurance. Putting a horse on ulcer medications doesn't address why the ulcers have occurred in the first place. So it doesn't address feeding management or medication factors that have contributed to the development of ulcers in the first place. And we know through this presentation for all the reasons why gastrointestinal health is so important for our horses' overall health and performance and well-being and recovery. And if we think that keeping a horse on ulcer medication is in the interest of their best health, we're missing out on opportunities to address all factors which could be helping their health and performance. So through the changes in pH and changes in gut microflora, we will get reduction in the synthesis of B group vitamins and vitamin K. So again, thinking about hoof health, thinking about energy production, about bone health, these are really important considerations. We will get changes in the production of neurotransmitters, which can influence mood, temperament, learning, and behaviour. And it's one of the many considerations we need to take into account when we've got a horse that's got behavioural or temperament issues and we think it's attributed to ulcers and we put them on ulcer medication and those behavioural temperament issues remain. This can be one of the many important considerations as to why. And as we mentioned before, omeprazole and ranitidine are not indicated in the case of hindgut ulcers or colonic ulcers. Now, this is a bit of inferred research, certainly important to take into consideration. To my awareness or to my knowledge, it hasn't been done in horses, but I think the mechanisms are very relevant and really important to take into consideration. So we certainly know that horses have a gut-brain axis, and we know that horses can experience depression and states of anxiety. So contrastingly, two ends of the spectrum. Now we know that proton pump inhibitors, so our omeprazole, can possibly increase the risk of dysregulating the gut-brain axis by preventing the proper absorption of nutrients key to the gut-brain axis function. And look, this is really, really likely, knowing the effects of our proton pump inhibitors on digestion and absorption, and through changes in gut microflora too. So some research has shown that omeprazole and proton pump inhibitors are associated with reduced brain serotonin. So remembering that serotonin helps our horses to feel good, it's a mood stabilizer, helps them to be calm, helps them to be happy. And it results in reduced dopamine metabolism. So again, important in terms of mood and temperament, but important in terms of gut mucosal blood flow. So this can lead to anxiety, depression, and cognitive or learning impairment. And we know that proton pump inhibitors can reduce acetylcholine production, which is involved in learning and memory. So again, thinking about how gut health can affect things so far removed from just digestion and absorption and the gut itself. So long-term, the implications of ulcer medications can lead to significant nutritional insufficiencies and deficiencies, particularly minerals, particularly B group vitamins. They, in essence of how they work, can result in compromised bone health. We know that because calcium uptake and some of our other bone minerals are severely inhibited. Now, I've put increased fractures with a question mark in that I'm unaware that there's research directly related in horses to fracture risk at this stage. It would be nice, if it was done as an after-finding, not as setting up a study just to see that. But if we think about it, we've got compromised mineral uptake. We know that there are key minerals to bone health to promote bone density and reduce fracture risk. If our horses can't utilise and digest and absorb those nutrients, it can be one of the many factors I would think that would increase their risk of fractures. Other medications can certainly come into account there, as can, if we think about racehorses, track surfaces, the way we're breeding. So it's just one small piece of the puzzle, but something I think we seriously need to consider. Again, we need to consider impaired immune function, both through microflora changes as well as the lack of first-line immune defence. There are some studies, not in horses at this stage, to my awareness, that the use of proton pump inhibitors has some effects on sperm parameters. So if we're thinking about breeding stallions, this is an important consideration. Certainly, we need to consider whether horses on either high dose and or long-term use of omeprazole or ranitidine too, in fairness, if they're taken suddenly off these medications, there's a risk that these horses will have what we call hyperchlorhydria, so where they have hypersecretion once they come off the medications, which we don't want. So in terms of if I'm treating a horse that has been on ulcer medications, whether it's been really high dose or if it's been on it long term, I will do a graduated step down dose of that medication in conjunction with nutraceutical therapy, herbal medicine, if appropriate, and dietary changes to help prevent that sudden hypersecretion in gastric acid. And as we've discussed for all the reasons before, ulcer medications are not a sustainable long-term approach if we want to promote the best health and performance in our horses. So I think we're nearly at the end of this. Preventing ulcers, diet and management are key. Fibre, I can't emphasize this enough. Feeding, if we're feeding hard feed, feeding small meal sizes, and also combining these with a source of fibre, so that, it's long been a practice that we feed concentrates alongside lucerne or alfalfa chaff, oat chaff in some cases. Even our beets, our sugar beets, so in Australia we have speedy beet, micro beet, but brand names differ around the world, but essentially soaked beet pulp. We want to be doing all we can to promote a healthy bacterial microflora balance. So this is fibre related, the diet, but also minimising the use of medications that disrupt it. Use of omeprazole and ranitidine for the reasons outlined previously. Feeding fibre prior to exercise. So again, if you're saddling up your horse, it's really good practice to give them, before you go out riding, give them a little biscuit of lucerne or alfalfa hay, or a little feed of lucerne or alfalfa chaff, or even just making sure they've got constant access to their hay, particularly before we ride. Limiting our use of non-steroidals, antibiotics and other medications, being really judicious in their use. So they certainly have their place, but we need to be very aware of the side effects they have and how we use them. When we're travelling our horses, where possible, travelling them with hay and making sure, for multiple reasons, that it's good quality hay with minimal dust in the airway health is certainly a consideration when travelling. Be aware of supplements. I've put a big asterisk next to this. Some supplements can actually make gastric ulcers worse. In terms of driving inflammation, we want to be really cautious giving our horses iron supplements, particularly in an inflamed gut with ulcers. Gradual weaning, so pasture weaning, taking one mare away out of a mob at a time, is most likely to have much better effects on gastric health, gastrointestinal health in foals. And strategic drenching. So we know that certainly parasites can compromise, high levels of parasites can compromise gut health and integrity, but we also know that some of our classes of drenches can affect gut microflora. So we don't want to be drenching more than we really need to. So for most of my clients, depending on how horses are managed, I like to adopt a strategic drenching approach as opposed to routine drenching. So when we're thinking about ulcers and gastrointestinal health in a horse, we want to be promoting the best overall health in our horse and keeping their gastrointestinal health as good as possible. We want to be working with the digestive system, knowing how a horse's digestive system works, not against it, so not shutting it down. So in terms of treating ulcers or gastrointestinal health complaints in a condition and or promoting optimal gastrointestinal health in a horse, we want to identify and address the causes or contributing factors to why they've got poor gastrointestinal health. We want to be emphasising dietary fibre, We also want to be ensuring that they get their basic mineral and vitamin needs met to promote really good, healthy gastrointestinal system as well as overall health. I use nutraceuticals and herbal medicine in many cases to therapeutically address nutrients which influence the gastrointestinal epithelium and mucous membrane integrity. I'll also use nutraceuticals and herbal medicine to modulate inflammatory pathways. I work to reinstate a really healthy gut microflora and look at strategies that we can employ on an everyday basis. So how people manage their horses, particularly in stud environments, stable environments, racing stables. This is really important because there are a lot of things we can do to help promote better gastrointestinal health in horses, and looking at ways we can modulate stress. So that can be directly through management practices, but it can also be through specific nutritionals and through specific herbal medicines. So ulcers, you've got to look for the silver lining of the clouds, I think, and they can give us the opportunity to review our feeding practices. So knowing that ulcers are a man-made disease, if our horse has ulcers, it can give us a real opportunity to improve what we're doing. So whether that be our feeding practices, it can give us an opportunity to review the way we use medications, the way we manage our horses, and to apply, if we've got multiple horses in our care, to apply these findings to all those horses that we're responsible for. It gives us an opportunity to identify and address factors which negatively impact overall health and performance, because if gut health is compromised, factors which influence overall health and performance are compromised. So it gives us the opportunity to ask ourselves what we can do to promote the best overall health in our horses. So finally, I think it's the way we can view it is a healthy horse is a horse that is in the best position to perform and be at its best. And we know that gastrointestinal health or gut health is a huge component of that. So thank you very much. I hope you've all stayed awake. And feel free to jump online to find out more about the work I do. On my website, there's certainly plenty of information which can be really helpful for you in terms of gastrointestinal health in your horse and a wide variety of health implications. Also do fairly regular posts on Facebook and Instagram, just with little snippets of horse health information. So feel free to jump on there. So thank you very much. And I hope you got something out of today. Thanks, Samantha. Thank you. Bye.
Thank you very much, Camilla. It was a very valuable webinar. I hope that a lot of our followers, customers will watch it again, because it will be available on our website and our fan page on Facebook. So I guess that a lot of questions can back to you in a few days when people watch it again. So thank you very much. It was great meeting. I'm also very impressed of your knowledge, of the information you told us, and I hope also that we'll do it again in near future.
Thanks very much, Martin. It's been terrific. And yeah, if people want to send through questions, feel free to. And it may be, depending on the volume, it may be that we do a follow-up session with questions. But
great.
Yeah, feel free to get in touch.
Okay.
Thanks very much.
Thank you very much. All
Bye.
the best. Bye bye. Hey.
Bye. Hey.